Hello everyone, my name is Almuzian. I'm a specialist orthodontist, and today we are not going to talk about orthodontically related or direct orthodontically related topics. We are going to talk about the endemic problem, which is the 2019, the novel coronavirus, and its effect on us. Again, this is my disclosure statement that I have no financial interest, and this presentation represents my personal opinion. This presentation is based on a paper which has been shared by my friends Mark Wertheimer from South Africa, as well as some information from the National Health Service in the UK, UK governments, as well as the WHO. So please refer to this paper, which I am going to share its link in the post. So first of all, let's just revise our information about coronavirus. It is a respiratory, it's a virus that causes severe and fatal pneumonia, firstly explored in China in Wuhan city, and it's spread to other countries, affecting more than 100,000 so far. I think they exceed this number, and they are similar to SARS in terms of the enzyme and the gene, but they are different in some signs and symptoms. So we are going to cover that, and most importantly, its incubation period is from 1 to 14 days. What's the clinical symptom? Well, and sign. Fever is the most important thing, and cough, as well as severe muscle pain, fatigue, and patient sometimes developed sputum productions, have a headache or even diarrhea. And also the CT scan of the chest will show some abnormality, which is actually beyond our scope, but the GP and the respiratory doctors, they are aware of that. In terms of epidemiology, it's mainly affecting male more than female, and this is based on the findings of the WHO, and mainly affecting older group. So the risk is higher when the patient is a senior, above the age of 60. And most importantly, it affects those who has compromised immunity. The method of transmission of this virus is the following. First of all, they can even transmit it from a patient who are asymptomatic. This is something very important. They can be transmitted directly by cough, sneeze, or droplets, or by contacting oral, nasal, or eye mucous membrane, and even some human fluids, as well as the fecal oral transmission, which has been reported, but it's not confirmed yet. So how it's transmitted in the dental practice or to the dentist? Well, they could be transmitted to the dentist through face-to-face communication, or through contacts, and also exposure to saliva, which we are really at high risk to be exposed to saliva, blood, and other blood fluids, and also even with handling sharp instruments and other contaminated surface, such as the tray and the handpiece and the handle. Of course, we inhale a lot of airborne microorganism when we use the high-speed handpiece and even the low-speed handpiece, and there's some report that this might be transmitted if we contact the nasal fluids, the conjunctival and oral mucosal fluids. So this is the most important thing, and I wanted to focus here, everyone, and how we can control the infection and how we can avoid transmitting the infection to other patients and to our staff and to ourselves. So first of all, you should advise all your patients before they attend that if they have been diagnosed with coronavirus, they should not attend to the dental clinic, and if they didn't report that to the preventive departments, then you have to quarantine the patients and report them immediately to infection control departments, because this is important for you and for the public. The second step is to evaluate the patients, and this is better to start at the reception area. So you might ask the patient to fill some questionnaire, and there are 7 questionnaire. One of these questionnaire are related to the patients, and some of the questions are related to patient close contact. So let's go to the patient close or questionnaire related to the patients. So you need to ask the patient whether they have experienced any fever in the last 14 days, and they answer yes or no, or they have developed a respiratory problem in the last 14 days, again yes or no, and also if they have traveled to the affected area, and these are the area which has been listed with the UK governments, and this is the they call it as endemic area. So if they they travel to this area or the surrounding area, or even if they transit in this in the airport of this country, they should answer yes or no. And finally, with regard to the questions related to the patient's condition, you need to ask them if they have been involved in any gathering, meeting, or they are in contact with unknown people, such as attending, a football match, or they went to a busy pub or coffee shop. This is something, very busy area for a long time. Then they have to report that. There's also some questions related to the patient's close contact, so you need to ask them if they are in contact, or one of their family or family member or friends who have been confirmed with the coronavirus in the last 14 days, and whether they have a friend or family member who visited the affected area and they developed, and most importantly, they visit this area and they developed a respiratory problem within the last 14 days. And finally, you need to ask them if they have any, if they come in contact with at least 2 people who have experienced fever or respiratory problem in the last 14 days, and they have in contact with direct contact with these people. So then after that, if your nurse or yourself, you can do a temperature measurements. It's highly recommended to use the contact-free forehead thermometers, which you can buy from Amazon or eBay. I checked its price, around 30 or 40 pounds. Again, I have no financial interest with the content of this presentation. Then you will come with 4 scenarios based on the 7 questionnaire questions and the temperature. So if the patient answers yes to any of the screening question and the temperature is below 37, then it's better to defer treatments for 14 days after the exposure events, and the patient should instruct to self-quarantine themselves at home. Questionnaire 2 is that the patient will answer yes to any of the screening question and they have a temperature which is more than the normal temperature. In this situation, you should immediately quarantine the patient and you should contact the infection control departments. Scenario 3 is if the patient answer no to the questionnaire, which hopefully that the patient will become transparent in this, and their temperature is below 37, then they are at low risk, but you need to follow the primary protection measure, and the primary protection measure include wearing gloves, cap, disposable face mask, gown, visor, goggles, all of this, and try to use a disposable latex gloves or nitrile gloves if possible, taking into consideration the medical condition and allergy of the patients. The last scenario is if the patient answered all the questions, screening question, by saying no, but their temperature is high. In this situation, they are at risk of having coronavirus, and it's better to instruct them to contact the hotlines for medical check and for test of coronavirus. Be careful not to advise the patient to visit the GP or the pharmacy. It's better to contact the hotline, and the hotline will advise them of the next step. And in this situation, it is a slightly gray area whether you are going to treat them or not, because if you decline their treatments and they have just normal flu, then there will be an issue. I personally, because orthodontic treatment is not something urgent, I will defer their treatment until everything is confirmed and the patient is confirmed negative to coronavirus. Otherwise, if I have to, then I will use secondary level of protection, which include the same level of protection in the primary protection level, as well as try to use an isolation of a growth or surgical gloves. So I will use slightly gowns or disposable gowns. So what about infection control? That will also use, regardless of whether the patients answer these questions, whether the patient is at high risk or medium or low risk. First of all, these are the infection control measures. These are the primary, secondary, and tertiary protection. We don't expect to treat patients who are at high risk and using tertiary protection. This is something dealt in the hospital, but there are some measures that we need to follow in order to reduce the risk of transmitting the problem to the patients and to ourselves and to our staff. And the most importantly is the hand wash. You should use antibacterial, certified hand wash, which actually run out of the market recently. And you should wash your hand for at least 20 seconds. And this is based on the NHS, recommendation. You should follow the surgical methods of washing the hand, exactly same like in this video. This is something very important. And after that, you wash your hands under running water and you dry it. Be careful. You should dry it very thoroughly. And after that, you can use the same drying towel to close the tap, and that's it. It's better to use a dryer if you can. Okay, what else? Another infection control method is to some people they recommend using a chlorhexidine mouthwash before you start dental procedure to reduce the microorganism, but we know that chlorhexidine is not antiviral. However, it might reduce the risk of infection to some degree. Some also recommend the using of rubber dam, high vacuum suction, and even anti-retraction handpiece to reduce the aerosol production. And of course, you and the nurse should disinfect the clinic after each patient comprehensively using wipe and alcohol. And of course, you should have protocol in managing the medical waste. And finally, in terms of shake hands and greeting the patients, I prefer to use a contactless handshaking, and this is a video by one of our dentists at the Berkeley Clinic in Glasgow, and he is demonstrating how the handshake should be done to reduce the risk of infection to coronavirus.
Everything else is contactless now. We've got Wi-Fi, contactless credit cards. Welcome to the world of the contactless handshake.
Hello, Mike.
Mike Gow, Interdental TV. Now, this is a bit of an awkward situation in the current climate. Now, obviously, handshakes we know are potentially one of the biggest sources of passing on COVID-19. Now, I'm a dentist. I'm coming in to meet a new patient for the first time. My new patient stands and he offers his hand for a handshake. I'm now in an awkward situation where do I want to have hand-to-hand contact with my new patient, not knowing whether he's been in contact with COVID or not. Again, obviously I don't want to cause any unnecessary angst. The World Health Organization has guidelines and protocols out just now. We know hand washing is one of the most important things, but we also know that hand-to-hand, skin-to-skin contact and then transference to the face is a potential source. So as I come in and I meet Marcus and I shake hands, that could be me picking up some of COVID-19 because he saw he was on his phone when he came in, and I'm not sure who he's been. So we'll just, there we go. So, what do we have as alternatives then? Well, there's a number of things I've seen on the internet recently. There are some interesting handshakes, including elbow bumps, which is a bit odd. If Marcus puts his hand out to shake my hand and I do this, it gets a little confusing. Fist bumps certainly would be a potential, but again, there's going to be bacterial and potentially viral contamination even with a fist bump. One thing I've seen some of the Iranians doing is foot-to-foot contact. So they meet each other, how are you? And they have a knock together of the feet, a foot shake if you like. Again, that's a little awkward. If Marcus stands up, offers his handshake, and I put my foot out, it could get a little bit confusing. So what else is there? Well, one thing that crossed my mind, the Romans had a great handshake. When the Romans shook hands, they engaged much further up and they shook hands here. And I thought for a while, this could crack it, this could be a new idea. And then I remembered the Health Organization are saying when you sneeze into your own elbow, and actually if I'm engaging a handshake here, I'm just right in the zone where Marcus has just emptied his nose and I'm covered in COVID-19 once again. So we'll get rid of that. So, what is the solution? Well, actually the solution was in a film in the early 1990s called Demolition Man. Now, Demolition Man was way ahead of its time. It predicted that Arnold Schwarzenegger was going to get into politics. It predicted GPS. It predicted driverless cars, electric cars. It predicted iPads, FaceTime. There's a huge number of things in that film that were bang on the money. And it's about 30 years old. The film was set in the year 2032. And in one particular scene, when they greet each other, they go for a high five and they move their hands around, and it's a contactless high five. So my suggestion is a contactless handshake. Okay, so the contactless handshake, how are you doing? Contactless fist pump, how are you doing? And the contactless high five, demolition man style.
Be well.
Again, thank you so much for your listening, and this is a Scottish way to say thank you, and hopefully everyone will be safe. Thank you so much.